Hello, I'm Sohail Butt. I'm a consultant orthopaedic surgeon in the Midlands Orthopaedic Centre at Russell's Hall Hospital. We run a virtual fracture clinic service which aims to review all injuries referred from the emergency department within 72 hours. Patients are given advice about their injuries and a treatment plan by a telephone call following this review. This provides an early diagnosis and treatment guidance to all patients. It also means that only the patients that need to be seen in fracture clinic have to come to the hospital. But for patients who have injuries that can be managed with self-care advice, hospital visits are minimized. The objective of this video is to give you guidance about an injury of the head of radius, bone in your elbow, and advice regarding treatment and exercises. You have a break in the radial head, which is one of the bones in your elbow. Radial head fractures are not treated in a plaster cast as the fracture is stable. This means you can move the joint without causing damage. These fractures almost always heal well given time and movement. A sling has been provided for your comfort and should only be used for a few days. This injury normally takes approximately 6 weeks to heal. The elbow may be swollen and painful. Rest your arm for the first 24 to 72 hours. Pain can be an issue. Take regular over-the-counter analgesia until the pain settles. Follow the recommended dose on the package. An ice pack will help initially with pain and swelling. Make sure the ice is not in direct contact with the skin and use it for about 15 minutes 3 to 4 times a day. You may use the hand and work within your pain limits. You may find it continues to be a bit achy and swollen for a few months after your injury. It is important to allow the fracture to heal to keep the elbow moving to prevent stiffness. You should avoid any lifting, pushing and pulling for the first 6 weeks. Keep moving the elbow gently and to gradually get back to normal daily activities within the limits of pain. There is, however, a risk that by forcibly stretching, you may experience pain and delay your recovery. We do not routinely follow up these injuries as they heal well. However, if you continue to have pain or are limited in what you can do, please get in contact with us on the number in your information leaflet. Also, if you are worried that you are unable to follow this rehabilitation plan, or if you are experiencing pain or symptoms other than at the site of the original injury or surrounding area, or if after 3 weeks you are not close to achieving full movement in your elbow, please phone the fracture care team for advice. Please follow the plan given in your information leaflet with regards to your management. In the first 0 to 2 weeks, wear a sling for comfort only. Take your arm out of the sling and practice moving the elbow. Do the exercises on the next page every hour in the daytime. You can start straight away. In weeks 2 to 6, try not to use a sling and do normal light activities with the arm. Don't lift more than a weight of a cup of tea for 6 weeks. Continue with the exercises until you have your full range of movement. In 6 to 12 weeks, the fracture will be healed. Resume normal day-to-day activities, but be guided by any pain you get. Heavy tasks may cause discomfort. In 12 weeks, if you are still experiencing significant pain and stiffness, please contact us for a further consultation.
Hi, my name is Deanna Evans and this is my colleague Vicky Hawke. We are senior physiotherapists working as part of the fracture clinic team at Russell's Hall Hospital. We are developing a series of videos to help patients remember the information and advice provided by clinicians. Research shows that only 10% of information given at an appointment is retained, so this video should help our patients remember the advice given. One of our consultants has guided you through the information about your injury and how this is managed initially. Then one of us will help you with rehabilitation and recovery advice. I shall now guide you through some information and advice regarding the rehabilitation of your injury. In the initial phase, 1 to 7 days of recovery, it is important to manage swelling and acute pain. We therefore advise you have relative rest of the injured area. This doesn't mean you have to stay in bed, but avoid strenuous repetitive work and activities and rest the affected area as much as able. Swelling is a natural part of the healing process, but it is important to manage excess swelling of the injured site. Ice and elevation can help to manage this. To help manage swelling and pain, we advise you use an ice pack, for example, a packet of frozen peas or ice cubes in a plastic bag. Wrap the ice in a damp tea towel and place it over the affected area as shown. Make sure ice does not come in direct contact with the skin. This will minimise the risk of an ice burn. Leave the ice pack in place for 10 to 15 minutes, but no longer than 15 minutes. And you can repeat this 4 to 5 times per day. If you have Raynaud's disease, peripheral vascular disease, impaired sensation affecting the area, or you have been advised against using ice for other medical reasons, do not use. Elevation of the affected area can help with swelling management. To do this, rest your arm and hand on pillows. Try to keep the limb elevated whenever you are sitting or resting if needed. It is important to regain the natural movements of the affected area as early as healing allows. You will gradually find you are able to use your arm more and more normally as time passes. You may get some intermittent pain with certain movements for some time. It is important to remember that it can be normal for your elbow not to fully bend or straighten. In the first 72 hours, it is important to keep your wrist and hand mobile as they may stiffen up whilst you are not using your arm as normal. For each of these exercises, perform 10 to 20 repetitions every 1 to 2 hours throughout the day, within comfort levels. Progressing the number of repetitions as tolerated. With the hand resting over the edge of a table or resting in mid-air, move the wrist and hand forwards as far as comfortable, then in the opposite direction, backwards as far as comfortable. Alternatively, you can do this exercise in your sling. Rest the palm on a flat surface, then move the wrist to side, as though you are doing a wiping action. Alternatively, you can do this exercise in your sling. With your hand resting in mid-air, bend your thumb and fingers to make a full fist, then spread your fingers and thumb apart as wide as possible. Alternatively, you can do this exercise in your sling. You can stop these exercises as soon as your function and use of the arm starts to resume. You can commence these exercises 72 hours after your injury. You will now also be ready to decrease the use of your sling as your pain allows. For each of these exercises, perform 5 to 10 repetitions every 1 to 2 hours throughout the day within comfort levels, progressing the number of repetitions as tolerated. Standing or sitting, support your affected arm with your other hand. Bend your elbow up to your face or shoulder. Apply a gentle overpressure as pain allows, then straighten your elbow and apply a gentle overpressure as pain allows. Standing or sitting, clasp your hands together. Keep your elbow tucked into your side. Turn your palm to face up to the ceiling and then down towards the floor. Apply a gentle overpressure as pain allows. It is normal to get some discomfort or pain when you exercise, and this may take anything for up to a few months to completely settle. However, it should not be severe pain, and any pain after exercising should be bearable. Your joint should not feel hot, inflamed, or develop lots of swelling after exercising. If your pain following exercising does not settle down within 30 minutes of exercising, you should consider doing smaller amounts of exercises, not push through high intensity pain, and discussing your pain relief with your GP. If there has been an increase in swelling, use the ice and elevation advice. If you are still finding your pain severe or unmanageable, or are concerned about lack of improvement, please contact the fracture clinic. You should be able to return to light household tasks from 2 to 6 weeks post-injury. Heavier or more repetitive tasks will take a little longer, usually 8 to 12 weeks. It is not unusual to struggle to lift heavier objects for up to 3 months after injury. Be dictated by pain with this. If you experience a high level of pain, then do not lift the heavier objects. Returning to low impact upper limb exercise such as swimming or riding an exercise bike would be advised from 6 to 8 weeks post-injury. Higher impact sports such as tennis, cycling over rough terrain is likely to take longer to return to, such as 12 weeks onwards. These timeframes may be longer depending on any pain or stiffness experienced. Finally, although the information in this video is based on current knowledge and best practice in managing typical conditions, all individuals and injuries are different. This may mean your symptoms do not follow a normal and predictable course. If this is the case and you have any concerns, please contact the Fracture Clinic.